Mayor is here. I see 1:15, so we'll go ahead and get started. Welcome everybody to our now bi-weekly information session on everything involving the COVID-19 pandemic and in the city of Bloomington, Monroe County, Indiana University, and IU Health. I'm Chuck Carney, Director of Media Relations for Indiana University. We will begin, as always, with opening statements. First, let's go to Bloomington Mayor John Hamilton.
Thanks very much, Chuck. Good to be with you all. Our first meeting in August, I believe. I'll give the quick data updates. We did have one new employee positive test this week. That brings to 90 our total number of employees in the last year and a half. We also are up to 570 employees who have demonstrated their vaccinations with the $100 wellness program that we have. For one bright spot, we grew by about 5% over the previous month period, ending 2 weeks ago. There was about a 5% increase in vaccinations submissions. Over the last 2 weeks, we had about a 4% growth. So that's a quicker pace. And I'll take that and encouraging all of our employees to get vaccinated as much as possible. Also, just quick report on the utility program. I've mentioned a few times, we continue the virus detection monitoring in the wastewater system. We had, as I mentioned 2 weeks ago today, we had 6 weeks in a row of no detection of the gene copies, which meant there were fewer than 10 gene copies per 100 milliliters. Last time, 2 weeks ago, I mentioned we had a one hit in the Dillman wastewater plant at a level of 12, so just barely detectable. This week, we did detect a level of 21 gene copies at Blucher Pool, that's the northern edge, and actually up to 460 copies at Dillman. Now, that's significantly up. It's still way below the highest levels in the winter, but, and I'll caution, these are somewhat experimental efforts, but I do want to share that just to note that in this past week, we did see a significant rise in the gene copies measured in the wastewater stream. We're going to continue to watch that closely and are trying to see if we can increase the frequency to continue to monitor. So we know a third surge is happening. We've made that clear, and the data makes it clear that's true in cases, it's true in positivity rates, it's true in hospitalizations. I know we'll get more data on all that. It's even true now in deaths at the state level that we're seeing a significant rise in the average death to COVID as a third surge. It is very frustrating. It's very alarming. We all know that masks and vaccinations are what we need right now. Please do your part. Thanks all of you who have. Maybe I would just emphasize, remember the school kids. Many of whom cannot get vaccinated under current protocols, but we need them in school. They need to be in school to learn and keep their lives moving forward. And the best thing all the rest of us can do to keep them safe, those who cannot get vaccinated, the best thing we can do is get vaccinated and mask up. So I will again express my appreciation for this group gathered remotely on this Zoom call, representing the various entities, in particular those like IU and IU Health and the school corporations that are not on this call, but who have committed to get their communities, employees, staff, customers, et cetera, vaccinated in great degree. That is a huge benefit to our community, and I thank you for that and all the work of the health department. I'll hand it back to you, Chuck, and happy to take questions.
Okay, let's next check in with the health department and Penny Caudle.
Good afternoon, and I guess I would say happy lucky Friday the 13th, right? It is Friday the 13th. So I will start today with the health regulations since that remains of interest to people. The current regulation to wear masks in indoor public places does cover communities throughout Monroe County. The current order is set to expire on 9/30, or if we see significant specific metrics and improvement, or if the Board of Health and the commissioners were to make changes to it. Public businesses, and that's their employees and patrons, are to wear masks unless they meet one of the exemptions that are in that order. This regulation did go through the legal processes as required, and schools are to follow CDC and Indiana Department of Health guidance, which is at this time includes wearing of masks. This measure was taken to increase precautions during the substantial spread of COVID-19 and the Delta variant being the predominant strain in Indiana, in order to slow the spread and to protect those who cannot be vaccinated, for instance, those who are under 12. Remember that we still have less than 60% of our eligible population fully vaccinated. Once we are through this surge, the hope and the expectations are that the regulations will not be needed and that vaccination rates will continue to climb. That, however, does require cooperation from everyone, regardless of opinions. Monroe County's cases per 100,000 rose to 109 this week. We had dropped to 27 per 100,000 back in early June. And in April, we had a point where we were at 105. So we are going backward, not forward, where we need to go. In terms of Indiana, average cases have increased 9-fold since July. Hospitalizations are the highest since February. Child and teen cases have jumped 84% from July 22nd through the 29th, and 5 times what was reported since the end of June, and that is for children. Children now account for 20% of the cases nationwide. The Delta variant is responsible for 93% of the US cases, and most people live in a substantial or high COVID transmission area. That is the majority of counties in Indiana. You can be part of the solution to this. Be kind to others, even when you disagree. Be kind to the workers doing their jobs. Wear your mask as required and if requested. Stay at home if you're sick. Get tested as appropriate. Follow guidance for isolation and quarantine based on your vaccination status. Continue good hand hygiene and vaccinate if you're eligible. If you have questions or concerns, please talk to a reputable resource, your private provider. There's lots of good research from reputable places online. Now, we have had some reports from individuals that we've been talking to about their vaccination and why it took them a while to kind of come in and get that vaccine. And while fear may have been what they said, it was not fear of the vaccine, but rather fear from repercussions and from family and friends and what they might have to deal with if they shared that information with individuals. So please be kind, and we want people to get vaccinated. We know that it is safe. The data is there. These are safe and effective vaccines. We are getting complaints. They are coming through on places regarding failures to comply with the regulations. Complaints may be submitted through our website as they were before. That is the most efficient way for us to process them. We start, as always, with seeking voluntary compliance until we have no other option for resolution. While there are some who are opposed to the current mask order, many are in favor of it. And I want you to think for a moment about the people, for instance, in our office or other offices who may be taking complaints all day and how difficult and challenging that job can be. One of our staff reported and wanted to share this information from someone who had submitted a complaint. While wearing a mask is uncomfortable, I think that doing what we can do to support those giving up their lives in medical care settings is a small price to pay to get through this with minimal loss of life and livelihood. Thank you to our public health workers for doing what you can to keep our county safe. So on to testing. We are monitoring the increased demand and need for testing during this surge. Going to coronavirus.in.gov for the map of testing site options is still your best starting place for where to go to get testing. Vaccine is still available. ourshot.in.us is still the best location to find those options for public clinics for you. We do continue to schedule outreach clinics. In fact, if you have not been vaccinated yet and you want to get one today, Food Truck Friday from 5 to 8 p.m., you can get Johnson & Johnson vaccine. We continue to do Moderna Mondays on Miller Drive. We appreciate you making an appointment there prior to that, but they will do their best if you walk in. Preparing for schools, we have many school clinics scheduled to start in September, and those clinics will have both influenza vaccine as well as COVID vaccine for those who are eligible. Rides are also still available. Kroger has joined with Lyft for discounted rides to and from vaccination appointments. You can visit kroger.com/COVID vaccine to schedule that appointment and a ride. IU Health still offers rides to sites, and you can call 1-888-IU-HEALTH and choose option 9. Brian, I hope that I got that all right. If you need help with a ride, and Uber is another option if you need assistance with transportation to a state site, and you can schedule that through 211. You can be a part of the solution. We have the tools to overcome this. The tools include prevention measures, including masks and vaccine. We must use them, however, in order for them to work. Back to you, Chuck.
Okay, let's next check in with Monroe County Commissioners and Julie Thomas.
Hi, Chuck. Hello, everyone, and thank you all for being here as always. Appreciate this collaborative community that's developed around this very serious issue. First, a thank you from the Board of Commissioners to everyone who has been vaccinated and to those who continue to serve us as our essential workers and our healthcare workers in our community in these uncertain times. We just want to make a quick note for residents who are dealing still with issues related to rent, utility payments, and basic necessities of life. The Monroe County Commissioners worked with the County Council to provide Township Assistance Fund. A Township Assistance Fund, we funded already $125,000, is administered through our Township trustees. Every county resident lives in a township, whether you live in the city, a town, or neither. So please contact your Township trustee if you need assistance. The funding is available to help you. So with that, thank you again to everyone in our community for all you're doing to keep us safe. And please get vaccinated. Thanks.
Okay, let's next check in with IU Health and Brian Shockney.
Good afternoon, everyone, and thank you to all being on this call now every other week, and also to those who are serving in capacity to support our team as well as our community. Our numbers of COVID-19 inpatients across the IU Health South Central region during the past week continue to rise to volumes we've not experienced in over 6 months. The numbers of Monroe County between IU Health Bloomington and Monroe Hospital show the same concerning trends. New COVID-19 cases in Indiana have tripled to their highest level since February, where hospitalizations have doubled since that same time. And this trend is evident across the IU Health system, where all of our IU Health hospitals in the state, our COVID-19 census has increased from an average of 60 patients per day in early July to almost 130 patients per day this last week. Fully vaccinated persons continue to account for a very small percentage of COVID hospitalizations, which is important because it shows that fully vaccinated individuals are more protected against the harsher aspects of the virus in comparison to those who are unvaccinated. To date, since March of 2020, IU Health South Central Region hospitals have admitted over 1,800 individuals with a primary diagnosis, that's not secondary, but a primary diagnosis of COVID-19. That is over 8% of all our admissions to our hospitals. These are individuals that could not maintain their oxygen levels nor be cared for without highly involved medical care. Over 95% of those patients have been unvaccinated. The numbers are important. They are important so that we can respond and ensure that we have the resources necessary to care for those who are very sick with this virus. However, I want to take a minute and ask you to reflect after 18 months of this pandemic. COVID-19 has deeply and profoundly impacted each and every one of us in some way, and we're all tired of spending time apart from those that we care about, unable to connect with each other through smiles and tears and seeing each other's faces due to wearing these dreaded masks, and having to work the structure of our lives and world around COVID-19. So I ask you to reflect on the last 18 months. Have you or a loved one been diagnosed with COVID-19? Have you unfortunately lost a loved one or someone you know with COVID-19? Have you or a loved one faced financial impact or a job change because of COVID-19? Have you lost out on time with loved ones, travel plans, big celebrations because of COVID-19? I know firsthand the leaders here on the screen today have been deeply impacted over the last 18 months. They've continued to make sacrifices each week, week in and week out, spent countless hours, including nights, weekends, and holidays away from their families. They've grieved the individual losses of community members and loved ones. They've put their time, talent, and resources and energy into COVID-19, and they've done it to help protect and support this community that we so dearly love. This pandemic in August of 2021 is not like February 2020 and even December of 2020. We have the answers. We have the supplies necessary to provide patient care. We have the treatments that can help heal patients. We have the vaccine that will end this pandemic. We also have more people dying. So I ask you, how do you want to treat the pandemic of August 2021? How do you want our community, our state, and our county to be reflected when we look back at this period of time in history? I can tell you that my hope and my passion is to be remembered as the generation that did the right thing when we were called upon to make a difference in the lives of others. We at IU Health want to focus on what matters most to our community related to the new hospital, the state-of-the-art technology, the improved service and delivery of care. We're aiming for that date coming here in December of 2021. We want to be able to utilize those resources currently being demanded by this virus and direct it to our vision of making Indiana a healthier state. So many have given so much, too much. And so many have followed medical and scientific advice and recommendations, and it is making a difference. Now it's time to put aside our differences, put all of our energy into beating this virus and creating a safer place for everyone. Then we can ensure all of the exorbitant resources being used to respond to this pandemic can be used to improve the health and well-being of those who seek to live their best life. The future is bright if we can demonstrate kindness, as Penny said, and care for our fellow man. Please join us in this fight by ensuring you and your loved ones are vaccinated, protecting yourself and others through masking, social distancing, and your best hygiene. Let's take action together to ensure a bright future for all. And I will take questions at the end.
All right. Let's next go to Indiana University and Kirk White.
Well, good afternoon, everyone. Good updates, although I wish our numbers were not going in the direction they are. However, vaccination rates are doing a bit better, and we can take some solace in the fact that that message is getting across. And along those lines, I'm really happy to note today that across all of our campuses across the state, we're approaching an 85% vaccination rate for our students, faculty, and staff. And that's higher even for the Bloomington campus, approaching 90%, 90. That's a great place to be. And that's why we're convinced that we've got a good chance of getting us back to normal and certainly back to what we're expecting. And that's why we're excited about welcoming so many of our students back to the campus. And along those lines, this weekend starts the major move of students returning back to our residence halls. We expect about 3,800 students to arrive on Sunday, the 15th. They'll check in centrally, and at that point, if they've been vaccinated, they will move on through the process. And if they have not yet been vaccinated or not fully vaccinated, they will be tested upon arrival. We then expect about 2,000 more to arrive in our residence halls over the next few days, culminating with the freshman induction ceremony on Wednesday, the 18th in the afternoon at Simon Scott Assembly Hall. For testing this fall, key to what our success was last year, before we had the vaccine, was maintaining a high level of testing. We're going to continue a lot of that this fall. We have several testing options that will all begin again next week. If students, faculty, and staff are not fully vaccinated, have an exemption on file with us, they will be tested once a week through our COVID check program. And that's how we'll be able to determine where our outbreaks might be. We will also have symptomatic testing available at our Student Health Center. And then, of course, as we have continued last year, we'll have asymptomatic testing available for students, faculty, and staff beginning the week of the 23rd. So that's all back online. And then classes, of course, will begin on August 23rd on the Monday. We'll continue our contact tracing operations this fall with anyone who does come up positive or reports a positive case to us. We'll help them with finding their close contacts and getting them into a quarantine situation if need be. Of course, we have our masking requirement indoors that we've announced, and we think that's the most judicious way to do things, and we're pleased to be in sync with the Monroe County and CDC guidance along those lines. And finally, as we've done all through the pandemic, we'll continue to work with everybody on this call, our community leaders in the government, healthcare, and emergency management areas to really monitor things on a daily basis. And if we need to make changes to the campus posture, we will do that. But at this point, we're very optimistic about where we'll be this fall, even though there's still quite a bit of threat with the Delta variant and the next waves of that may spike over the coming weeks in Indiana. And with that, I'll put a link on to some of our welcome back announcements and look forward to any questions. Thank you.
All right, thanks, Kirk. So going into questions from Dave Askins, the B-Square Beacon for Penny Caudle. Do you know if the new 2020 census figures will be incorporated into the state's dashboard for the per capita statistics?
I have not heard the state report that yet. I could see that happening. Certainly that would mean a change in those. So I'm not sure what their plan is at this time, Dave.
Question from Dave for Kirk White. Can you confirm the vaccination rate for the IU Bloomington campus close to 90%?
Yes, that is correct. That's an average. Our faculty are a little higher than that. Staff is about that level and students a little less. So it's about 90% is where we're approaching.
And one thing that I always note when we talk about 85% throughout the IU system is that we're still getting some, not a lot, but some still in. So it's not, that doesn't mean that those are all exemptions necessarily. We still have some reporting to get in at this point. Another question here from this for anyone. Given the very high relative rates of vaccination for the Indiana University community, that means the rate for non-IU affiliates in Monroe County has to be significantly less than the countywide number, which is now around 57% of those eligible. Would it be useful to come up with a non-IU affiliate rate of vaccination so we don't feel complacent about having a better rate than other counties in Indiana that don't have a major university located there? Penny, I'll throw that to you.
Sure. Well, certainly don't want to be complacent with our numbers, regardless of what they are, right? That's a tall order. It would be interesting, certainly, to be able to separate those out, except I will caution you that when IU reports those numbers, their faculty, students, and staff are part of our community. Many of them live here on a permanent basis, whereas oftentimes we think about students as coming and going, but they don't all do that. So that is a very difficult thing. Certainly, I'm sure the incoming freshmen are changing those numbers and those kinds of things. So it is a very good question. I don't know that we have the true ability to separate those out, but I would say this: we want everybody to consider being vaccinated if they are eligible, so that those numbers are all high and we can feel very secure about them. And then I'll let others chime in that may have additional things to say. Going
once? If anybody does. Well, if not, we'll go ahead and move on. This one again from for Penny from Ethan Burks, WFIU, WTIU. What has the county's communication been like with the Seven Oaks Classical School in Ellettsville? Are they still refusing to require masks? And how is the county's legal department planning to address the issue?
Certainly, Ethan, we continue to reach out. We have reached out to Seven Oaks and people at the school, and we'll be using our typical process of trying to work this out without any fines or going to court or those kinds of things. Those are the last things that we want to do. I believe that we all have the same goal, and that should be that we want children in school and we want students, faculty, and staff to be safe. And right now that would mean masks. So we are looking at, we double check laws. We make sure that we're within the bounds of where our authority is, and we will continue that follow up and take whatever action we need to take.
This question from Ethan for Brian. Can you talk a little bit more in detail about the severity of people hospitalized with COVID? Are all of them unvaccinated? How many on ventilators?
Thank you for the question. So those of you who have had family members or loved ones who have come to our emergency room or any emergency room with COVID-19 symptoms oftentimes believe and know that they feel so terrible that they want to be admitted to the hospital. Although that's not the case. When we admit people, they truly are people who cannot keep their oxygen saturations up to a safe level and that are at risk of truly losing their ability to function and be in serious conditions. So there are lots of people in our community who struggle with this virus and believe that they should be admitted, but have to hit certain criteria before we would admit them to the hospital. So I want to say that because every patient who is an inpatient with a primary diagnosis of COVID is a very, very sick individual. Now, let me go to the ventilator. Right now, we've only got 13% of our ventilators in use. Over this 18 months of the pandemic, we've learned a lot about this virus, and we've learned a lot about how to try to use high flow oxygen to keep people off of ventilators. That's the last resort we want to go to. So where before we were continuously reporting the percentage of ventilators in use, and that percentage was high, that is lower now because we are utilizing other methods to treat people before we would go to that ventilation on a ventilator. And then as far as those who are vaccinated, it's a very low number. Again, it's over 90s, always above 90% of those admitted to the hospital and hospitalized are vaccinated. How are unvaccinated, I'm sorry. But however, with this COVID Delta variant, we are starting to see individuals who are immunocompromised who are coming into the hospital in a situation where they need to be hospitalized and they were vaccinated. Now that number is still very low, but it is new over these past couple months where we're starting to see vaccinated individuals who are sick enough to require admission where they cannot keep their oxygen levels up and need to have that supportive care in a hospital 24/7 environment, which means get vaccinated. Get vaccinated so this virus doesn't spread. The Delta variant and all the other variants that have come and may come in the future are because we are not getting vaccinated. Our bodies are hosts to this virus and create these variants. And so the solution, vaccination.
Okay, we'll take some more questions if you have them. We have a few more minutes left here. Kirk, as promised, has put that link up there. Kirk, do you want to add anything to that?
Well, I do want to add some good news that came to us yesterday that many of you are tracking. The United States Supreme Court refused to block the vaccine requirement that we have. Indiana University was really the first test case going through the federal court and now to the U.S. Supreme Court. Indiana University was one of the first out of the blocks with this, and now the tally nationwide is close to 675 colleges and universities that have a vaccine requirement. This just shows that we are following the science and doing the best that we can, that we've tried all along, the health and safety of our students, faculty, and staff, and by extension, the communities where we live. We want to keep those as safe as we can, and we're pleased that the legal system used past precedent for upholding our requirement, citing the requirements for other vaccinations. And so we think that will continue to stand and help us on our road to recovery here.
We do feel like we are in very good shape starting the fall semester with that in place. And again, any other questions that we have here for the group before we go? And by the way, biweekly can mean either every 2 weeks or twice a week. So it's really confusing. So every other week is the way we'll refer to this. And so I'm not going to say it's a biweekly news conference. Although technically it is, or maybe it's not. We'll be back here a week after next is the plan, and then we may adjust afterwards depending on circumstances. So seeing no other questions, we will return week after next for our next Friday news conference. Thanks everybody for your questions. We will see you then.
Thank you.
Thank you very much.